The OET speaking subtest gives you rubrics or guidelines to help you know what to expect and how your performance will be evaluated. Let's take a look at these rubrics so you'll know what the speaking examiners are looking for. Hi, I'm Sharon, and this video is brought to you by Benchmark Education Solutions. Let's take a look at how your OET speaking test will be scored. Remember, this is a test not only of your grammar and your medical knowledge, but of how well you communicate. Let's look at some tips that will help you succeed on this test. When examiners evaluate your OET speaking test, they will look at these two areas: linguistic criteria and clinical communication criteria. In this video, we're going to look at the linguistic criteria. These are the language skills that you've learned and practiced over time. There are 4 parts to the linguistic criteria rubric: intelligibility, fluency, appropriateness of language, grammar and expression. Let's start by looking at intelligibility. Intelligibility just means whether or not the examiner can understand you. Your voice should be clear, and you should pronounce the words correctly. Don't speak too quickly or too slowly, but at a speed that is normal for you. Remember that when your speaking test is scored, the examiner will be listening to a recording of your voice. They won't be able to see you or hear you in person. So it's very important that you speak clearly into the microphone and pronounce all your words completely and well. Are you able to pronounce all the English sounds? Take some time to review the sounds of English. One common sound that English learners typically have trouble with is the th sound. The position of your tongue is critical for this sound. If it's in the wrong place, your th will sound like a t or a d. Make sure you can see the tip of your tongue between your teeth. Don't be afraid to stick your tongue out. Try these sample words with me, and remember that th can be voiced or unvoiced. Think, think. This, the. Word stress and intonation are also important. English has a very specific rhythm and pattern of word stress. The best way to learn English intonation is to listen to native speakers and copy them. Let's try it right now. First, listen to me speak. Treatment for head lice is recommended for people diagnosed with an active infestation. All household members and other close contacts should be checked. Those with evidence of an active infestation should be treated. Now listen and repeat each phrase after me. Treatment for head lice is recommended for people diagnosed with an active infestation. All household members and other close contacts should be checked. Those with evidence of an active infestation should be treated. Now say it together with me. Treatment for head lice is recommended for people diagnosed with an active infestation. All household members and other close contacts should be checked. Those with evidence of an active infestation should be treated. Keep practicing like this with your favorite podcasts or TV shows. This will help your English sound more natural and easy to understand. Now let's talk about fluency. Fluency refers to the rate and flow of your speech. Don't speak too slowly or too quickly. Try not to pause for too long while thinking of the correct words and expressions to communicate your message. Don't use filler sounds like and okay, because these interrupt the smooth flow of your words. If you begin to feel lost and that you can't find the correct words, take a deep breath and try not to feel overwhelmed. Take control of the conversation again, perhaps by looking at your role-play card and repeating some of the language you see there. Appropriateness of language is all about using language that your listener can understand. So keep a tone of formality with your patients and their family members. Don't use medical terminology your patient might not understand. You're a medical professional, but if you're speaking to a patient or family member, they may not know all the medical terms you use to communicate with your colleagues. For example, if your role-play card includes a term such as myocardial infarction, you can choose to use that term with your patient, but you may also want to include an explanation of what that term means. For example, you could say, I believe you had a myocardial infarction. This is also known as a heart attack. Remember, even if you don't say anything technically incorrect, you need to be sure and choose the correct words to succeed in communicating with your listener. This includes using an appropriate tone of voice. For example, if you're delivering bad news, make sure your voice is appropriately sympathetic. If you're discussing sensitive and private information, your voice should be properly quiet and sincere. Remember that this is an important part of your speaking grade. Make sure your listener can understand your word choices and that the tone and volume of your voice are appropriate to the message that you have to deliver. Grammar and expression is where you will demonstrate your knowledge of grammar and vocabulary. An important skill in OET speaking is the ability to paraphrase when necessary. Paraphrase means the ability to repeat back or reword what the patient has told you to make sure you've understood correctly. This requires an understanding of idiomatic phrases and how to use certain expressions correctly. Another example of paraphrasing is not to repeat word for word what you see on your role-play card. For example, if your role-play card says, ask the mother why she believes that immunizations are dangerous, you can demonstrate your knowledge of vocabulary and grammar by choosing different words to ask your question. You could ask, tell me where you heard that vaccinations will harm your child. If you're feeling nervous, repeating what you see on your role-play card is totally fine. But if you're feeling a little more confident, paraphrasing what you see on your card can help improve your score. Remember, the most important thing is to cover all the points on your card in the 5 minutes provided. You may get a few extra marks if you're able to use idioms. Here's an example. If a patient comes to you and seems very worried and agitated, you can tell them, don't worry, you're in safe hands. In safe hands is an idiom that means you are safe here, I can help you. Here's another example. Remember the mother that thought immunizations would harm her child? As you explain the benefits of immunization, you could say, prevention is better than cure. That is an idiom that means it's easier to prevent something from happening than to fix it after it has already happened. You might want to do some research to learn more idioms related to medicine. Get familiar with them and try to use one or two in your OET speaking for some extra points. A common mistake in OET speaking is using plurals incorrectly. Review plurals and understand how they are formed and when to use them. Another common mistake is in the use of articles, a, an, and the. You will want to review these and make sure you're comfortable with them. You should also be able to use a variety of verb tenses correctly. Remember, you'll have 3 minutes to review the information on your role-play card and 5 minutes to speak. Linguistic skills are important in the OET speaking test. In Part 2, we'll see how you use your linguistic skills to complete the clinical communication criteria. You can practice your OET speaking with us here at Benchmark Education Solutions. You'll get one-on-one online practice, 2 role plays, and instant feedback from friendly and helpful OET experts. Check out our website at edubenchmark.com for more information, or click the link in the description. Subscribe to our channel and click the little bell so you don't miss any tips that will help you with your OET exam. Thanks for watching, and I'll see you in Part 2.